This video discussed the most important foundation of Phaco emulsification. The Phacodynamics. The root of success. Phacodynamics or Phacophysics is the application of physics in cataract surgery. Understanding of basic things that hidden in every steps of the surgery help improve surgical techniques and maximize the benefits of modern technologies to overcome all difficulties that we may face with. Phacodynamics involves fluid mechanics, physics of energy and forces which we use during the surgery. I still remembered doing challenging cases using the 9001 machine in which the fluidics of the machine was not so stabilized, and surgical skill play an important role for the safety and success of the surgeries. Modern machines nowadays help improve safety and efficiency in difficult cases and also make training much safer. During the surgery, the inflow of fluid from the irrigating solution is balanced with the outflow from aspiration and leakage, so the anterior chamber will be stable. This is the dynamic balance or homeostatic balance because the fluid get in and out of the eye most of the time. And fluid in is equal to fluid out and the IOP is stabilized. In most machine, the irrigation come from balanced salt solution that hang at a certain height above the eye. The IOP can be calculated such as 59 mm mercury when the bottle height is hanged at 80 cm. This create enough inflow in the old days. But modern Phaco create demand for a higher inflow because we are driven towards smaller incision and are using high vac and high flow. More irrigation means more bottle height and more IOP, which may be as high as 80 mm mercury at 110 cm of bottle height. There are some other inflow determinants such as irrigation tubing size and length, size and design of infusion sleeve and tip. High IOP may create some problems, such as vision loss in advanced glaucoma, central retinal vein occlusion, and stretching pain in high myopic eye. Large irrigating line of some machine will allow more inflow with the same bottle height. Aspiration outflow is mainly created by a pump. There are two major types of pump, the peristaltic and the Venturi pump. Peristaltic is a flow-based pump, vacuum will rise after occlusion, can create high vac at low flow, create good holdability that best for chop. Venturi is a vacuum-based pump, vacuum come instantly, create high flow with good followability that best for quadrant and cortex removal. In modern machine, the two pumps are improved so much that can work very similar. The new peristaltic will rotate very quick, create high flow with short vacuum rising time. Some modern machines come with both types that user can select according to their preference. Regarding the aspiration flow rate, when there is no occlusion, it determines followability. But when there is occlusion, flow rate will determine vac rising time and nuclear removal time. Both inflow and outflow create followability that brings nuclear segment to the tip. Some tip and sleeve designs may create good or bad followability. Picture on the right shows a forward fluid stream that may push the segment away. Angled the tip and sleeve to either side may also reduce inflow because of constriction at the incision. We can observe AC fluctuation. There are two types of irrigation, Coaxial using 2.2 to 2.75 mm main incision with 1 mm side port, and bimanual using two 1.5 mm incisions. Using irrigating chopper in one hand. Vacuum is a negative pressure that rising when there is occlusion. Vacuum determines holdability and enhance emulsification by US energy. Higher vacuum requires less US power and energy. There are two systems that we should know. They are venting and reflux system. Venting is the system that reduce vacuum when we stop aspiration, or when occlusion break occurred. Venting help reduce surge. Most modern machine utilize fluid venting by open the vent valve inside the cassette. This will allow the irrigating fluid to go into the aspiration side to reduce vac. Reflux system is activated by foot switch. This is an emergency system used when we accidentally aspirate iris or capsule. Fluid in the aspirating line will flow reversely and the tissue will be pushed away from the tip. There are two types of reflux system, the reversed pump reflux, which reverse the pump rotation. The other type is the fluid reflux system. The reflux valve will open to direct fluid from the irrigation side to the aspiration side. Ultrasound is the key component of Phaco emulsification. Vibration of the tip will cut the lens into small fragments, like the jackhammer. The more US power, the more force to fragment a harder lens. Tip angle can be selected, 0, 15, 30, or 45 degree. The 45-degree tip is sharper than 30-degree tip and can cut hard nucleus better, but tip occlusion to hold segment during chop will be not so good. I prefer a 30-degree tip in all cases. This animation demonstrates the function of US power and vacuum. When we hit someone's face, his head will bounce away and he may not hurt much. This is similar to Phaco sculpting. But if we use another hand to hold his head and hit again with the same force, this time, he will hurt more. This is similar to Phaco aspiration. These are functions of the US power to hit the nucleus and the vacuum to hold the nucleus against the hitting force. In bevel-up Phaco sculpting, impact force is determined only by US power. Vacuum plays no role. So we have to increase US power with a harder cataract or change Phaco tip to a sharper one, which may be compromised by less occlusion during segment removal. During segment removal, the tip is occluded and vacuum is rising. This is called Phaco aspiration. The impact force is equal to tip impact, determined by US power, plus holding force determined by vacuum. We can increase vac and or US power, when we face with a harder cataract. Emulsification is enhanced by vacuum, less US energy is needed. In bevel tip down Phaco aspiration, the tip is occluded in both grooving and segment removal. So we can increase vac and or US power when we face with a harder cataract. Emulsification is enhanced by vacuum throughout the surgery. This is why I prefer bevel down Phaco. Settings for grooving hard nucleus. We need a higher vac and US energy to gain more efficient emulsification and to prevent clog and burn. The vacuum during grooving is 150 mm mercury, and the flow rate of 25 to 30 cubic centimeters per minute. The irrigation is between 80 to 100 centimeters. US power may be set between 50 to 60%. During chopping and removing segments, we need to increase vacuum between 350 to 400, and flow rate between 30 to 35. And use pulse or burst mode ultrasound. We may also use torsional ultrasound to reduce heat. We also need larger incision of about 2.75 mm to allow enough irrigation for higher vac. During segment removal, we should observe for clog inside the tip when occlusion tone rise with sustained high vacuum but no nuclear fragment at the tip. We have to clear the clog to prevent incisional burn by injecting viscoelastics through side port and remove Phaco tip. Then we build vacuum and ultrasound in the test chamber outside the eye until the clog pass. Fluidic imbalance can happen during aspiration. The anterior chamber may fluctuate or even collapse. The possible causes may be occlusion break surge, too low bottle height, wound leakage or too tight, high vac, high flow settings, aspirating tube compliance. Compliance in the aspiration system may cause by tube elasticity, and air in the aspiration line, which lead to surge and slow vac rising time. To reduce compliance, newly designed system has thicker aspiration line and more rigid cassette. Occlusion break surge of new systems improved when compared to older system. Due to improvement in tubing, cassette, and venting system. Problems of surge, clog, and burn can be minimized by adjusting parameters. To optimize vac, flow, US power, and irrigation, between efficiency and safety. For more efficiency, we need all high parameters. High vac, good holdability, less US energy, short removal time, less clog. High flow, good followability, short vac rising time, short removal time. High US power, rapid emulsify, short removal time, less clog. High irrigation, less surge, less AC fluctuation. For more safety, we need all parameters, not too high, but not too low. Too high vac, surge. Too low, pump stop, clog, burn. Too high flow, AC fluctuate. Too low, slow rising time, long removal time, burn. Too high US power, burn. Too low, clog, burn. Too high irrigation, vision loss in advanced glaucoma, CRVO. We are working at the marginal of irrigation reserve, because of high vac, high flow, and small incision. We may need some improvements to gain better irrigation. The irrigation system shifts from passive gravity fluidics to active compression fluidics, with active pressure monitoring system. The fluid is compressed in a closed chamber. So more irrigation, and better IOP control is achieved. Occlusion break surge is lower in active fluidics. Pressure sensor inside the handpiece actively monitor the IOP, and signal the controller to adjust for target IOP. Real-time IOP monitoring reduce AC fluctuation. Occlusion brake surge volume is reduced by real-time control of venting valve. The videos demonstrate active fluidics in action. The IOP is stable. Soft nucleus requires special attention. Settings should be lowered, to promote pulling followability without premature segment disengage. We do slow motion Phaco, using lower vacuum 250 mm mercury, lower flow 20 to 25 cubic centimeters per minute, lower US energy 40%. If we use high parameters and pull too fast, the segment at the holding site will break, and we will lose the segment. Pulling should be slow and gentle. For a loose zonule, we should also do slow motion Phaco to prevent surge that might break more zonule. Use lower vac, 120 mm mercury for grooving, 250 for segment removal. Use lower flow, 20 to 30 cubic centimeters per minute. Dispersive viscoelastics can be used to protect the capsule while we slowly pull the segment. Irrigation fluid can travel behind the capsule and make the PC float. Slow motion settings help reduce the chance to aspirate PC. During IA, we can use high vac and high flow with minimal chance of surge because the IA port is small. The irrigation bottle height is about 70 cm during cortex removal, and will lower the height to 30 cm during capsule polishing. Prevention of burn is important. We can use both technologies and techniques to this purpose. Technologies includes high vac, high flow, higher US power for hard nucleus, energy modulation, pulse or burst mode, torsional or transversal ultrasound. Techniques includes larger incision for hard nucleus, intermittent use of ultrasound during nuclear removal, early recognition of clog. In linear continuous US power, the US power is stronger when we push the foot switch deeper. But at the beginning, the US energy will be less than the threshold level that the nucleus will break. So some energy is wasted. Ultrasound energy can be modulated with a lower frequency wave to form pulse or burst ultrasound, which work more efficient, save energy, and reduce burn. Pulse mode has off time between pulses. Off time is the time for cooling that help reduce burn, time for repurchasing that help reduce nuclear chattering, and time for vac rising that help utilize vacuum to reduce US energy. I prefer 10 pulses per second during chop and nuclear removal. But use linear continuous ultrasound during bevel down grooving. Torsional ultrasound help reduce burn by generating less heat. But cutting action is not as good as longitudinal ultrasound. So in a hard nucleus we can combine torsional and longitudinal ultrasound for more efficient emulsification. I had been using 22-degree bevel down torsional for many years with some limitations in a hard nucleus. When 12-degree tip was introduced, I began to use it because less bent tip has better maneuverability inside the eye, especially for bevel down technique. After using 12-degree tip for some times, I recognized that 12-degree cut hard nucleus better than 22-degree tip. In order to find the reason why 12-degree tip cut a hard nucleus better than 22-degree tip, we have to look more into some physics. The construction difference between 22 and 12-degree tip is the distance from the center of rotation to the center of bevel. The 22-degree tip has a longer distance. Let's have a look at a physics formula of torque. Since 22 and 12-degree tips share the same amount of torque because both are driven by same mechanism, so 12-degree tip, which has shorter radius, will deliver more cutting force. A seesaw board diagram will help us understand why 12-degree tip gives stronger cutting force. Balanced tip is a new tip designed for use with torsional ultrasound. It improves cutting and reduce heat. Some system combines longitudinal with transversal ultrasound using a straight tip. This help reduce heat and promote cutting. Now we will discuss about some special interest in phacodynamics. High myopic patient may feel pain or discomfort during the surgery, even under retrobulbar anesthesia. The cause may be because of a sudden change in the IOP during tip insertion, the AC is suddenly deepen. This may also associate with a high bottle height because we use high vac, high flow, and small incision. The key solution for this problem is the slow irrigation. Slow irrigation can be performed by slowly insert Phaco or IA tip, using continuous irrigation while inserting. The AC will be slowly deepen. Irrigation fluid will leak less when the tip is inserted more into the incision. We will stay at position in picture 2, where some fluid leak and some fluid go into the eye. And wait until the AC is deep. Another technique for slow irrigation is by pinching the irrigating line and insert the tip. Then slowly release the pinched line and see the AC slowly deepen. Slow irrigation can also be done by slowly raise the bottle from 30 cm to the desired height. Slow motion Phaco, using low irrigation, low vac, and low flow, help reduce discomfort in high myopic eye. Let's look into the fluidics of hydrodissection for safety and efficiency. To achieve complete hydrodissection, we can observe 3 signs. Fluid wave sign occurs when fluid wave front traveled across the posterior capsule. After fluid wave reach the opposite side, we will continue injecting a little more fluid. Small amount of fluid that collected behind the nucleus will push the nucleus up, creating the nuclear lifting sign. Then we push the nucleus downward. The collected fluid will travel around the equator to the capsulorhexis margin, creating the fluid escape sign. The hydrodissection is completed when we see these 3 signs. To have a good hydrodissection, we remove some viscoelastics by pressing the posterior lips of the incision. This allows us to inject more fluid without overinflate the eye. Another important factor is to use a small syringe which create a high flow fluid jet when inject short pulse with high force. 1 ml insulin syringe has smaller cross-section area, which create higher pressure with the same amount of force when compared with a larger syringe. Higher pressure will create a higher flow. This is the hydraulic principle that applied for a more efficient hydrodissection. This video demonstrate hydrodissection using 1 ml syringe and a 27 gauge cannula. Press the posterior lips to release some viscoelastics. Then inject fluid under capsulorhexis margin, using short pulse, high force. Repeat injection pulse until fluid wave and nuclear lifting sign is observed, then push the nucleus downward to release the fluid. If we continue to inject more fluid after nuclear lifting sign is observed, the posterior capsule may burst. There will be a sudden AC fluctuation. If we wrongly place the cannula over the capsule, the fluid may misdirect into the vitreous, causing a sudden shallow AC with a tense eye. If this happen, we need to do pars plana vitreous tapping to remove the fluid. Small syringe system is very powerful and can be used for subincisional cortex aspiration. After viscoelastics injection to fill the anterior chamber and capsular bag, the remaining cortex can be pulled from subincision and aspirate, using a bent 27 gauge cannula connected with a 1 ml insulin syringe. PC rupture may occur during capsular polishing. Lowering the irrigation bottle height may lower the chance of rupture. In active aspiration, if the bottle height is too high, the true vacuum pressure will be higher than what we set, and venting system may be impaired. When we aspirate the capsule and move, the capsule may break. The total aspiration pressure is the sum of active aspiration created by the pump, and passive aspiration created by the bottle height. To learn about passive aspiration, we can detach the aspiration line from the handpiece. We will see the fluid drop out from the handpiece. This is because there is a pressure gradient between the AC and the atmosphere. This can create pseudo-aspiration at the port, and may be used for passive capsule polishing. We can raise the bottle height for more aspiration. Watch this video carefully. When the aspiration line is detached from the handpiece, the fluid will drop out and the capsule can be gently aspirate to IA port. Observe capsular folds while the IA tip is moving. I usually use normal IA settings for capsular polishing, but the knowledge from passive aspiration make me change bottle height to 30 cm to reduce the chance of capsular break. In conclusions, Phacodynamics is inspired in every moments of the surgery. It's our skill that brings success to the surgery, along the road paved with Phacodynamics sand and concrete foundation. With special thanks to all staffs at Metapracharik Hospital and Eye Institute for supporting my work. Thank you very much.